Hey guys, Ashley with Amare. So, few resources for you guys. We are located in Elizabeth and Highland Park, New Jersey, and I also offer virtual consults. So, if you guys need my help, give the office a call, 732-841-0142, and our scheduling coordinator can help you get set up with an appointment. We also have our online shop. So, all the products that I talk about in my videos, those are all in our online shop for you guys to purchase. On our Instagram, Amare Healing Arts is our Instagram. All the products are linked right there in our bio. Also, the online shop is linked, and it's linked in the description box for each video. So you guys can go and check those out. And then we have our online course school, the Post-Op Academy. So all of the things that you would need to know post-op, we are doing online courses for. So things like what kind of massages you need, when you need to get them, who to get them from, how to find a therapist like me, all of that we have online courses for. There are going to be more courses coming out all the time. So check in on that to see what's new and what you guys can learn. If you like my videos, all of those courses are exclusive content. All those videos are exclusive content. None of them are on YouTube. They're all in our courses. So that is amarehealingarts.teachable.com. The link for that is also in the description box, and it is also linked in our bio on Instagram. So I hope you guys enjoy the content. Ashley with Amare. I will see you soon. Bye.
Hey guys, it's Ashley with Amare. Hi, that's me. Okay, so today we are talking about cellulite. Now, why are we talking about this? Because I have a lot of clients that come in all the time with all these different things, right? All these different procedures, all these different ideas, all these things you guys hear and see on the TikToks, the interwebs, the Instagrams. And this is why I do all my videos. Nobody explains to you guys what the thing itself is. They're just like, oh, you have cellulite. I can fix that. Ta-da, here's a magic cure. Okay, well, all right, let's figure out what it is first to figure out what magic cure actually works. You will hear that wood therapy, where they're scraping away at your body really, really ridiculously, helps with cellulite. You will hear that you just need to lose weight, or there are exercises and creams and all kinds of stuff. Guys, this is a physiological thing, okay? This is not just like mush your body in a million different ways and expect it to cooperate. There's an actual like anatomical cause for cellulite. So we're going to talk about it. Now, let's talk about when it happens. So cellulite can happen after puberty. Cellulite can happen after menopause. A lot of times it's in women, right? Women are very concerned about the cellulite after pregnancy, after menopause, after puberty. Maybe you've had it your whole life. Maybe it's genetic and runs in your family, which it can. It can be a genetic thing, and we'll explain why as we get into our article. You know me and my articles. But it can happen at any point in your life, right? And a lot of people call it like cottage cheese legs, or like if you push your skin together like this and it dimples. Guys, you guys are also really, really rough, like really rough with your bodies. My skin is smooth when it's laying flat, correct? If I do this, you're gonna see some dimpling. I'm pushing tissue together. You're gonna see my pores, right? So cellulite is not when you just squeeze your skin together and it like, I don't know if you can see this, like wrinkles and dimples. That's going to happen if you, look at me. Like that's going to happen if you do that on any skin. It's when your skin is laying flat and it's smooth that you see those divots. They're like little tiny craters, right? So when we're looking at cellulite, because if I was wearing shorts, I'd show you, even on my thighs, right? If I have rock climbing thighs, I got some big thighs. There's a lot of meat in here. There's a lot of muscle. There's a lot of tissue. If I just like squeeze together my thigh like this, I'm going to see some dimpling. That's not how we tell if it's like real cellulite. It's when you're standing up straight or when you're laying down and your skin is flat and relaxed at, its normal resting tension. Do we see that dimpling? Do we see that those little like craters? Do we see that cottage cheese or that oatmeal? That's when we're looking at it as cellulite, right? So it can happen at any age. It can happen at any stage. It can happen for multiple reasons. There is a genetic factor. It does run in the family sometimes. And there's a couple of reasons for that we'll get into when I talk about the article. There's a hormonal factor, and we'll talk about that as well as to why. But it's something that is more cosmetic than anything else. Cellulite doesn't spread. Cellulite is fibrotic bands that are pulling your skin down. So it's not so much, this is your skin, right? The cellulite is not so much like bumps, right? It's not like huge lumps that are sticking out of your skin. It's the band in between, the fibrous band, that is tight and shrinking and fibrotic, that is then causing all of this skin and tissue to have pressure and buckle. Now, two things. One, that fibrotic band can be flat in here. I wish I had like here. Let me use my hair tie to explain this. It's gonna be a lot easier for visual purposes. Okay, so we have this fibrotic band in between here, right? This fibrotic band gets really, really tight. And as it gets tight and it shrinks, all this tissue around it starts to bubble up like this on the sides, right? And the divot here is what you see as the cellulite, where this is the normal plane from when it was flat. So two things can be happening. One, over time with age, these collagen, elastin, fibrotic bands of tension start to shrink, causing all this tissue to pull, and the band is the culprit. Or you gain weight, and all of the fat cells around the fibrotic band start to increase like this, and the band stays the same. So either way, it's the band that's the issue. We're having problems with that connective fibrous band in between the skin that's starting to cause tension, causing that bubbling and making an indent. The cellulite is the divot itself. That's the issue. So I have an article here from the Cleveland Clinic, one of my favorite places. It's clevelandclinic.org/cellulite. You guys can go look that up. But it says cellulite is the name for a collection of fat that pushes against the connective tissue beneath your skin. It often appears on your thighs, stomach, and buttocks. Cellulite makes the surface of your skin look lumpy and puckered or appear dimpled. What is cellulite? Oh, it's the same thing. That's the same sentence. Okay. All right. What is the difference between cellulite and lipedema? Now, this is extremely important. There is a condition out there called lipedema. I'm sure you guys have seen it, where people have like a really tiny waist, really tiny upper body, and like really big, heavy, like full and accumulated with fat legs. And I'm going to show you a picture of that in a second so that you can understand the difference. Does cellulite come with lipedema? Sometimes. Is it the same thing? Absolutely not. Lipedema is painful fat syndrome. It is a genetic condition. Cellulite is localized. It's one area. Lipedema is your whole legs. So, and it can start, and this is why this article mentions it, it can start in the upper thighs and look like just cellulite and then accumulate over time. It's where your fat cells grow uncontrollably, pretty much. That's lipedema. And then because they're growing uncontrollably, they're putting pressure under your skin, causing swelling. That's the edema part. Lip is fat, edema is swelling. I'm going to do a whole video on lipedema like later down the line. But it's not the same thing, but it can be commonly misdiagnosed. So lipedema, the difference between cellulite and lipedema. Lipedema is a medical condition that causes excess fat to accumulate in the lower part of the body, so waist down. Lipedema often most involves the buttocks, thighs, and calves. The upper arms are sometimes affected. It doesn't affect the hands or feet. So the hands and feet will be like normal size, but the legs will be massive. Right? So lipedema causes your skin to become sensitive. If you have lipedema, your skin may hurt, swell, feel cold, or bruise easily. Your skin texture often changes as well. It may look like cottage cheese, oatmeal, or orange peel. As lipedema gets worse, it can affect your ability to walk. So the main difference, which this article doesn't really do a good job of explaining, but I'm going to explain it to you. The main difference, lipedema is painful. Cellulite is not painful. Cellulite is cosmetic. But lipedema is painful. Your skin is sensitive. It hurts. It's heavy. It's like cool or bruises easily and is like ow. Like really ow. Not just cosmetic. Like when you guys are like squeezing and grabbing at your tissue and grabbing at yourselves, feeling for that cellulite that you're like pinching and squeezing, like, oh, look, I have cellulite. Look at all this cellulite. You wouldn't be able to do that with lipedema. It would be way too painful. So cellulite is not painful. Cellulite is a cosmetic condition. It also most often involves stomach, butt, and thighs. And it also looks like cottage cheese, oatmeal, or orange peel. Cellulite may look embarrassing, but it isn't painful. So that's the difference. Who does it affect? Cellulite affects men and women. However, women get cellulite at a much higher rate than men because of the hormones. Because we have a lot more hormone fluxes, which means our fat cells flux a lot more. How common is this condition? Oh, also swelling. accompanied with that hormone flux can also be a big part of cellulite, which we're going to talk about at the end when we talk about treating cellulite. We're going to get into the whole manual lymphatic drainage swelling part of this. So, how common is this condition? Cellulite is very common. Between 80 to 90% of women who've gone through puberty have cellulite. Less than 10% of men have cellulite. Genetics, sex, age, and the amount of fat on the body and your skin's thickness determine how much cellulite you will have and how visible it is. Your age, your skin, as you age, your skin loses elasticity and can make the appearance of cellulite more evident. Gaining weight can also make the appearance of cellulite more prominent. So what was I just saying? What is that analogy I just gave you, right? So two things. We've got this block of tissue. We've got fat cells here. We've got fat cells here. As you age, the skin gets lax, but that fibrous band doesn't, and it starts to look like this. Or as you gain weight, these cells inflate and this fibrous band stays here, pulling down the skin, causing this divot here, right? So the loss of elasticity may make the appearance more evident. Weight gain can make the appearance more prominent. So there's two different things, evident versus prominent. Prominent is where these bulges of fat are sticking out, and then the evident part is where it's kind of always been that thick fibrous band, but now that your skin is more laxed, you're seeing it more. So two different things. Although people with obesity have pronounced cellulite, it is not uncommon for very lean people to notice the appearance of cellulite. Why? Because it's about the bands itself, not always about the fat. How does cellulite affect my body? It doesn't affect your overall physical health, and it doesn't hurt. However, you may not like how it looks. Okay, so this is super important. Really, really cool part of this article, which I love. Cellulite looks bumpy or dimpling skin. It may be visible at all times or only when you pinch your skin. Cellulite affects your stomach, thighs, and butt. 4 grades. Cellulite has 4 grades. Grade 0, there isn't any cellulite. Grade 1, your skin is smooth when you stand up. This is what I was talking about before. Your skin is smooth when you stand up, but mild dimpling appears when you sit down. Grade 2, your skin has moderate dimpling when you stand up or when you sit down. Grade 3, skin has severe dimples when you sit down or stand up. Your skin also features deep peaks and valleys, raises and depressed areas. So again, when there isn't any cellulite, you're just here, chilling, living your life, going about the world. It's all good. Everything looks smooth. You're A-okay. It's one nice flat plane. Grade 1, your skin is smooth when you stand up, but when you sit down, you start to see divots. Not by squeezing and pushing your body together, but when you're sitting, you start to see those ripples in your skin. That's grade 1. Grade 2 is when you stand up and you can see the ripples just by your tissue naturally laying the way that it does. You're seeing the ripples, and when you sit down. And then grade 3 is you're seeing those ripples all the time. So this is the juicy stuff. What is the main cause of cellulite? It is not known what causes cellulite. Okay, we have a few things to say about that later. Cellulite forms when fibrous bands connecting your skin to the underlying muscle tightens irregularly. So again, either we lose elasticity from the skin itself around those bands, or those bands are being like tethered and tight and stretched because the fat is increasing, or for whatever reason those bands are becoming fibrotic and shrinking. So this tightening pulls down on your skin, and the normal layer of fat beneath your skin is pushed upwards. That's one way. The result is puckering appearance on the skin. It's also not known why cellulite is more common in women than men. One theory involves the bands connecting your skin, or your hypodermis, subcutaneous tissue, and the deep muscle layers. In men, the fibers that make up the connective bands crisscross together. In women, the fibers that make up connective bands run the same direction and are equal distance apart or parallel. So ours go like this, guys go like this. Parallel bands may show puckering better than crisscross bands. So women's connective tissue bands are like this, guys are like this. So when they start tethering, it's kind of even across the skin. Ours are up and down, so it gives that kind of valley and peak situation going on. Another theory is that higher amounts of hormones, estrogen, may cause cellulite, which is true. Cellulite often develops when women produce more estrogen, usually during adolescence or pregnancy. Like I said in the beginning of this video, puberty, pregnancy, and menopause are the 3 times when women start seeing cellulite a lot. Is cellulite contagious? No. You can't spread cellulite through skin-to-skin contact. What? Why is that even in here? How is cellulite diagnosed? Cellulite is easy to recognize. It's literally all it says. Is it possible to get rid of cellulite? So, what gets rid of cellulite? A combination of exercise, diet, and treatments can reduce the appearance of cellulite. FDA has also approved several treatments for cellulite, including sulfina, cellulase, QWO, and Aveli, which we are going to talk about because that's the only one that really works. These can improve the appearance of dimples on your skin. Cosmetic surgeons use a variety of treatments to reduce the appearance of cellulite temporarily. These treatments include deep massage to puff up the skin. Absolutely not. No. Acoustic wave therapy to break up cellulite with sound waves. Maybe, depending on the cause of the cellulite. Laser treatments to help thicken the skin. I would never suggest that. Liposuction to remove fat. However, it's deep fat, not necessarily cellulite, which is where Aveli comes in. The only FDA cellulite, actual approved cosmetic thing that's out there that works. Mesotherapy, which is needles injecting drugs into the cellulite. Please don't do that. Jesus Lord, no. Subcusion, which is a needle inserted under the skin to break through the bands causing cellulite. That is what Aveli is. Aveli is a machine. It's a handheld device. I'm going to post a picture of it. Don't worry. It's a handheld device, and it's got a cannula, and there's a little light. And I'm going to show you guys a picture of it and a video. And in the cannula, there's an opening. And in the opening, there's a little metal piece that does this. That actually, when you insert the cannula, they press a button and it does this, and it snags the band. And as the surgeon pulls back, it snaps that fibrotic band. So that's how it works, and that's the only thing I would suggest. But we're gonna have massive swelling and stuff with that, so we got to talk about that. Creams and lotions containing caffeine or retinol. That's going to treat the skin. It's not going to treat the band. This is the problem. All of these things are trying to treat the skin or skirt around it rather than hit the thing directly, which is the fibrotic band. Spa treatments, which can temporarily make cellulite less noticeable. Yeah, because you're swelling up the skin. Vacuum-assisted precise tissue release to cut tissue and fill out dimpled skin. I would not suggest that. Radiofrequency, ultrasound, infrared light, or radial pulse to heat the skin. Again, all you're doing with all of these things, guys, is creating swelling, puffing up the skin, and then when the swelling comes down, that's why this all says temporarily, when that swelling comes down, the band's still going to be there. It's still going to be a problem. Can exercise get rid of cellulite? Exercise can help improve the appearance of cellulite. Didn't say get rid of, said improve the appearance. Regular exercise increases your muscle mass, which flattens cellulite. It also increases blood flow to certain areas of your body, which speed up fat loss. The following activities can help improve the appearance of cellulite: running, cycling, resistance training. Why? Because it's dealing with the fat. It's shrinking the fat cells so that that band stops being so tight and the skin comes down and lays flat. What can I eat if I have cellulite? I did not get this far down in the article, guys. Some of this stuff is wild. You can eat what you like if you have cellulite, but bad eating habits increase your risk of developing cellulite. High-calorie diet that features a lot of carbohydrates, fats, and preservatives, and salt may contribute to the development of more cellulite because of the fat. Can traditional medicine or treatments reduce the appearance of cellulite? So then it goes into cupping and grapeseed oil and dry brushing and all kinds of things that are completely irrelevant. How soon after treatment will I start to see results? Okay, acoustic wave therapy, subcision, which is the needle thing, retinol creams, exercise, prevention. How do we prevent cellulite? You can't do anything that guarantees that you won't get cellulite because there is a genetic and hormonal component. That's my part. They didn't have that in the article. But there are some steps you can take to help reduce the risk, including avoiding processed foods that are high in carbohydrates, fats, preservatives, and salts, taking supplements that contain caffeine, grapeseed extract, or ginkgo biloba, exercising regularly. Okay. Living with cellulite, questions I should ask my doctor about treatment, and notes from the Cleveland Clinic. That's it. So, guys, cellulite is... All right, so here's a bunch of things we're going to address. First of all, hormonal. What happens to our bodies? Women's adipose tissue, women's fat tissue. Fat cells shrink, They don't, unless we're removing them with liposuction, it's a cell. And I talk about this in a couple other videos. It's a cell. It's going to inflate or it's going to deflate, depending on lifestyle, depending on hormones, depending on what we do, depending on baby, right? All these things. So if the cellulite is really a big problem, let's say you are proportionate and you are working out, and like they said, a lean person can still have cellulite. Why? Because cellulite is not fat. Cellulite is the fibrotic band between the fat. Like they said, that parallel vertical connective tissue band between the muscle and the skin that is tethering and pulling on the skin. Either it's shrinking and getting tight, or the fat cells are getting bigger and it's just doing its normal job of holding you together. So with hormones, we're going to gain fat in those cells, but also swelling. Guys, this is the other thing, and this is why lipedema was mentioned in this article. Lipedema comes with swelling as well. There's swelling around the fat cells. The fat cells are swelling and growing in size, causing the painful part of lipedema. That's the swelling, is the painful part. So when we're talking about cellulite, we have to look at why it's there and how it got there. And this is the big problem with you guys trying to treat cellulite and not knowing what to do, who to go to, or any of that, or why these things aren't working. Because we need to know what caused the cellulite to be there. What's happening? Is it that we gained a lot of weight everywhere and we have those fat cells? Well, then the answer would be, okay, we need to start losing weight, visceral as well as subcutaneous, so diet and exercise. Or is it hormones? Is it age? Is it swelling, not fat? Are we working out like crazy and eating amazing, but we have cellulite, but also we have a super puffy face and we've got our arms that feel super heavy and we feel sluggish and swollen? Or you don't know that you're swollen, but you're doing everything right to work out like crazy and you still have all this weight? That's a swelling thing. We can get rid of that with manual lymphatic drainage. And once we decongest, because manual lymphatic drainage is decongestive therapy, once we decongest the tissue itself around the fat cells, that comes down. Manual lymphatic drainage has been known to get rid of cellulite. Get rid of, right? Because cellulite is the band tethering the skin dimpling, right? That's the thing itself, is the skin dimpling. Why the skin is dimpling is going to be what approach we're going to take. So like they said, it can be genetic, right? That sometimes that connective tissue or those bands are just very, very taut all the time, and it's genetic. And you hit menopause and you don't gain weight, but you all of a sudden have cellulite because those bands are starting to shrink. The skin is starting to become laxed. So if it is not a diet exercise issue, if it is not a weight loss issue, right? Because if that's the case, then we get up on our gym game, we get up on our non-preservatives game, our low sodium game, our protein game, we start eating right, we start drinking, 3 to 4 liters of water a day, and we get the rest of our body in shape, and that cellulite resolves, right? So that's good, because it's a whole body thing. It's not just targeting the one area, right? So take that off the table. Let's say you're someone like me who rock climbs, who's slanging and banging all day with everything, moving around, doing everything, right? Everything looks great except my thighs. I have cellulite on my thighs, right? I don't, but I'm saying I have cellulite on my thighs, right? Let's say that's the case. And it's just on like the outside of my thighs or the back of my thighs. That may just be genetic. And in that case, that's when we want to look at something like Aveli, where we're actually addressing those fibrotic bands. Or let's say it is menopause and it is age and the elasticity of the skin is starting to come down. And we're not going to be able to inject you and get that elasticity of the skin back. And we're not going to have you gain weight to fill that out, right? We're not going to inject Botox and fillers into your legs. What we're going to do is release those bands. And that's where Aveli comes in. So I want to show you guys really quick the difference between cellulite versus lipedema. I have a pretty good picture here. I want to see. Okay, ready? 1 second. So I want you guys to take a look at this. Cellulite is here, right? This one localized area. Lipedema is this whole thing. Your feet aren't affected, but you will have that dimpling, that swelling, that fat distribution all throughout your hips, your legs, everywhere, and it'll look disproportionate. Cellulite's not disproportionate. It's just a dimpling of the skin itself. when we look at actual lipedema, and I'm going to do a video on this, I promise, these are the stages of lipedema. So stage 1, right? This is not cellulite. This is lipedema. This is completely different. Cellulite is just the skin itself. It's not this entirety of the limb where we have all this going on here. So we're talking about purely cosmetic, right? And we're talking about making that skin look smoother. Now, a lot of times, Aveli or cellulite, procedures are paired with liposuction. Why? Because again, 2 parts. We've got the band in the middle and the fat on the side. So if we're doing liposuction and we're taking out that fat, we're not addressing the subcutaneous bands. We're addressing that deeper layer of fat. There was a part about that in this article somewhere, but we're not addressing those bands themselves. So when we do a procedure like Aveli, where we're taking that little fish hook and we're grabbing the band and we're snapping it, we are actually addressing the band itself. So I'm going to post on my Instagram probably next week, either the reel or the post itself. If I can get them all into a post, I will, because I have 2 different reels I want to share, just like I did with the Renuvion one, where the surgeon is showing you how they mark when they're using the Aveli tool and how the little fish hook goes under the skin and hooks the band. And then when they pull, they do like this, it grabs it, and then they pull the button and it pops the band. And you can literally see in real time, just like I posted with the Renuvion, you can see in real time where that depression releases. So we want to make sure that when we're talking about cellulite, if this is a really big thing for you guys and you have a lot of it and it can be super, super, super frustrating, rubbing your skin alone is not going to get rid of it. If it is true cellulite, if it is cellulite due to those bands, if it's not edema and swelling throughout your legs, if it's just a patch, a localized patch, this would be something to help with that. If you do not want to undergo a surgical procedure, right? If we don't want to do liposuction to your legs, if we don't want to go in with Aveli afterwards and fish hook those little bands and pop them to get the skin to have a smoother appearance, if it's not just 1 or 2 spots, but it's like a lot, manual lymphatic drainage, this gentle skin stretching motion. Why do I say that? Because again, guys, it's not always fat. A lot of times it's swelling, causing that dimpling of the skin. A lot. One thing I also see a lot is on the face, people who have really big pores, right? And I'm not talking about depressions. I'm talking about, I could see every single pore on your face. That's swelling from behind, pressing on your skin, making everything inflated. That will happen with cellulite as well. If you're realizing that you're in menopause, or especially after pregnancy, right? Where we just had a baby, let's say pregnancy, we just had a baby. We had all of this wonderful fluid that baby was floating in, right? And then afterwards, we seem to still have that heaviness to the legs and the hips, and it's localized, and we still have all of that swelling in there from the baby. That is something we can get rid of with manual lymphatic drainage. We get you in a compression garment. We get you set up with the Amare lipofoams, which are going to help address some of that fibrotic buildup, right? Those fibrous bands and things like that, and fibrous heavy, dense swelling that's building up from after baby. And we do manual lymphatic drainage, and we pump that swelling out of you, you pee it out, and then everything smooths. But guys, you have to understand with that, there is a difference. That is from baby. That is not a genetic, I have cellulite, it's really bad, I need something surgically done about it. That's different. That's, again, like I said, localized, one tiny little area. When you're talking about the entire back of your leg, or like you'll see in the video that I post, the Aveli live procedure video, where it's a few little dimples. The surgeon marks like 3 or 4 spots on one leg, and that's it. If you're talking about like massive cottage cheese type oatmeal-y, orange peely situation, that may be something you're going to need to look a little bit further into and see, okay, did I have baby and now this is where this is coming from and it feels heavy and it feels thick like it's swollen? Did I hit menopause and my face and my arms and everything started retaining water? You guys know I hate that term so much. You are not retaining water, it is swelling. But am I like, do I feel like my ankles are blowing up too and I'm retaining water everywhere and I just feel really heavy as I'm going through like this hormonal change? Am I starting to gain weight that I can't seem to lose? Because hint, it's not weight, it's swelling from the hormonal flux. If that's the case, then let's try manual lymphatic drainage first, or schedule a consult with me and I'll be able to tell you, yeah, you should get Aveli. It's a great procedure and I think it's going to work. Or you know what? We're going to do like a lymphatic detox first. We're going to get you some manual lymphatic drainage. We're going to get your diet back on track and let's pump a lot of this swelling out of you. Because after we do that, like I said, with cellulite in general, you can be very tiny and have those thick bands and dimpling pulling on your skin. Or you can be very congested with swelling, with fat, and that's causing all that pressure next to those bands tethering on the skin. So it's the cause itself. It's the cause itself. Cellulite is not just one cause. Cellulite is the symptom of whatever the cause of the pressure is, right? So whether it be the tight band or the fat or the swelling under your tissue, like your tissue is swollen and you're seeing every single divot in your skin because it's so engorged with swelling underneath the surface. So when we're talking about cellulite, we're going to keep this video nice and short. Wrap it up in a pretty little bow. When we're talking about cellulite is the dimpling of the skin caused by bands that are tethering on the skin. There are lots of reasons cellulite happens. It can be from hormone changes. Adolescence, puberty, pregnancy, and menopause are the most common. Cellulite is not just about fat, it's about the connective bands in between. There are several things that we can do to help with cellulite, such as manual lymphatic drainage or Aveli, which is that little wand that goes in there and fish hooks the bands and releases them so that divoting releases. Diet and exercise is another one. If the fat is the cause, if it's swelling, it's manual lymphatic drainage. If it's the bands, it's Aveli. It depends on what caused the pressure to make the divot of the cellulite. That's what it depends on as far as how we're going to treat this. That's why you guys are doing all of these like rubbing and cupping and wood therapy and radio frequency and all kinds of treatments and it's not working because you're not looking at the root cause of the cellulite. So that's my short little video. 2 things we want to assess before thinking about surgery for cellulite, right? 1, have we done everything we could do as far as weight loss? If we have, and it's still there, 2, have we looked at it as swelling? Have we looked at manual lymphatic drainage? Have we looked at what could have caused the swelling? It may not be fat. You guys do it all the time. It may be swelling. It may not be fat. That pressure under the skin could very much be swelling. And now here's what happens. You get a procedure like Aveli, or you get liposuction, and that swelling stays under the skin, and guess what? Your dimpling comes back. Why? Because you're healing with that swelling inside of you. And now it looks like the Aveli didn't work. Because you didn't have a compression garment, because you didn't do manual lymphatic drainage, and all that dimpling and that pitting and those peaks and valleys are coming right back because your fluid is again engorged with swelling from the procedure. And if we're not doing manual lymphatic drainage after these cellulite procedures, you're not going to heal nice and smooth. You're going to heal with those fibrotic pieces inside of you again, except this time they're going to be lumps and bumps. They're not just going to be fibrotic bands dimpling your skin. They're going to be actual lumps and bumps under the skin that you can see. And it's not going to look like cellulite. It's going to look like lumps and bumps under there, and you're going to be able to feel it. You're not going to have a smooth, nice, pretty contour because you're healing with swelling inside of you because you're not doing manual lymphatic drainage. The last little piece that I'm going to leave you guys with, if you are going to do Aveli, which is a cellulite procedure, you need to be getting proper manual lymphatic drainage massages afterwards. You need to be in a compression garment. It is surgery. I don't want to hear any of this nonsense like with you guys in Renuvion where it's like, no, it's just Renuvion, it's fine. We are dealing with a layer directly under the skin. If you have swelling under there, if that starts turning hard and fibrotic, you're going to see it. You are going to feel it. It's going to look crazy because it is so superficial. Whereas with lipo, it's a little bit deep. You can feel the irregularities, but if they're swelling on top, you won't be able to see them. If you are not doing manual lymphatic drainage after Aveli, and if you are not wearing a compression garment after Aveli, you can heal with those fibrotic pieces inside of you. And this time they're going to be big lumps and bumps. They are not just going to be little tethery bands causing divots. They're going to be actual lumps and bumps under your skin. So if you guys need help figuring out the cellulite situation, if you're like, this cellulite hurts, it may not be cellulite. It may be lipedema. And it may not even be lipedema. It may be swelling. If your cellulite hurts, it is swelling. Cellulite is not painful. So if you are touching your cellulite and you're like, oh God, that really hurts. I feel like I'm bruised and I don't understand why. Your tissue is so congested that it is making you sensitive. You need manual lymphatic drainage massage. You need a compression garment. You need the Amare lipofoams. We need to get you on a protocol because that's not cellulite. That's swelling. And this is the main reason I'm doing this video. Cellulite and swelling are two different things. They may look the same, but they feel different. So if you're having that kind of a situation, go ahead and call the office, 732-841-0142. If you're having an Aveli procedure done, where you're having the Aveli thing to release the connective tissue bands under there, you're going to need aftercare. You're going to need post-op care. You're going to need a garment. You are going to need foams. You are going to need manual lymphatic drainage. It is still a procedure. You are still on the Amare post-op protocol. You still need all of these things to do after surgery to make sure that you heal right from the Aveli. So call the office. Schedule a session with me. I do virtual, and I'm also in New Jersey, Highland Park, and Elizabeth. 732-841-0142 is the office number. You guys can reach out to me if you need me, and set up an appointment, and we can get you assessed and figured out and set up on an aftercare protocol for this Aveli procedure, or figure out a way to help with the cellulite. But 90% of the times we address the swelling first, and that takes down a lot of it, because the last thing we want you to do is be swollen, go to address those bands, go in there, pop all those bands, and still have swelling and still look big, and your skin still be dimpled, because we're addressing the wrong kinds of dimples, because they're not cellulite dimples, they're swelling. They're divots and dimples of the skin from swelling. They're not those caverns and valleys from that connective tissue band. You guys don't know what you're looking at a lot of the times, which is why I'm trying to explain it to you. But if you need help with that, call the office, set up a virtual with me. We'll figure out what you got going on and how we need to attack it and what it's like. And how we need to take care of it after whatever we're going to do to help get rid of it. So I will post the reel. I'll try to post 2 reels instead of a picture this week. I'll post a reel and then another reel about this video going up on our YouTube, so that you guys can see what it looks like, what that whole Aveli thing looks like. But it is so far the only thing that actually addresses the bands of the cellulite to get rid of them, to completely pop them and get rid of them, and release those bands so the skin is smooth. That is the only thing, because again, based on what we're treating, that's how we need to go about it. So guys, this is Ashley with Amare. This was one of my shorter videos, 36 minutes. I will see you guys soon. If you need me, you know where to find me. Ashley with Amare. I hope this was helpful. Bye.